More than 150,000 COVID-19 infections were reported in the U.S. Monday. Health officials are encouraging parents to vaccinate their kids while also pushing eligible Americans to get their booster shots as the country fights off yet another surge. But as CBS News correspondent Nikki Batiste reports, a new option could soon be available to treat the virus.
Pfizer asked the FDA today to authorize its pill, currently intended to treat unvaccinated people with COVID-19 who are high risk. The drug is meant to be distributed at pharmacies and taken at home over 5 days. Pfizer says its antiviral pill would treat mild to moderate COVID in patients with increased risk of hospitalization or death. If given within 3 days of symptoms, it was shown to reduce severe outcomes by 89%. As cases rise in just under half the country, some states aren't waiting for the federal government to expand access to booster shots for all adults. At least 7 are doing it on their own.
A booster isn't a luxury. A booster isn't an add-on.
Current federal guidance recommends boosters only for those 65 and older or people at high risk 6 months after Pfizer or Moderna vaccination. So far, just over 16% of adults have gotten a booster.
So the states are jumping the gun somewhat. We've collected new data now showing the importance of third immunization, and the states are able to be a little bit more nimble and move faster.
Cases are rising in more than 20 states, and pediatric cases are up 22% compared to 2 weeks ago.
And if we go into the winter, we're at 70,000 cases per day. You're going to start seeing breakthrough infections even more so than we see now among the vaccinated.
That's what happened at the Gear Nursing and Rehabilitation Center in Connecticut, where a COVID outbreak led to 8 deaths. 89 residents and staff were infected, and all but 2 were vaccinated. Still, there's some pushback against vaccine requirements. South Carolina and 11 other states are suing to block the Biden administration from implementing a federal vaccine mandate for healthcare workers, calling it unlawful. Pfizer's booster for all adults could be available as early as this weekend, making tens of millions more Americans eligible for an additional shot. Elaine?
Nikki Batiste, thank you. For more, I want to bring in Dr. Payal Patel. She's an infectious disease physician at the University of Michigan's Medical School. Dr. Patel, welcome. So, first of all, can you explain how exactly does Pfizer's antiviral pill work?
Yeah, both of the oral pills that are hopefully coming out soon work in a little bit different ways, but they basically help stop the virus from continuing to replicate in your system once it's there, helping you stop before you get so sick that you have to get hospitalized, maybe can't breathe on your own. So they're working in different ways. This new pill actually uses some technology that we use to treat HIV as well.
Interesting. Well, overall, COVID-19 cases in the U.S. had been going down for weeks, but as we just heard, at least 20 states are reporting increases in cases and hospitalizations. What may be contributing to this recent uptick?
I know it's disappointing to hear every time we hear about this. I think that there's probably 2 things contributing. One is human behavior, right? I think many people are tired of masking, whether they're going to the gym or to a restaurant, they're kind of pushing some of the limits that they may not have been pushing a few months ago. So that's one of the things. And the other is the colder weather. And so you're seeing in some of the states that probably colder weather is leading to more social interaction indoors. I think those are the 2 things that are probably causing the rise in infections.
All right, on the topic of indoors, so D.C. Mayor Muriel Bowser announced Tuesday the city will no longer require masks to be worn in most indoor public settings. Doctor, what is your thought on that decision as we head into winter with these cases on the rise? And do you think that more cities and states might follow?
This is a good question. I think this is a decision that people really need to think about for themselves. So if you feel like, you're more at risk for infection, if you're vaccinated or not, it still makes sense to wear a mask when you're going to be in a situation where you're going to be very close to other people for an extended period of time. But at the same time, as we move towards more and more people becoming vaccinated, I think it is time to think about in what situations can we come down from masks. And I hope that as more and more children get vaccinated, we're going to be able to make some movement in schools as well.
Well, finally, several states and New York City have expanded their booster eligibility to all adults, even though the FDA and CDC have yet to sign off. Should people be waiting for the green light from federal health officials, or would you recommend people go ahead and get their booster shots if they're available? I wonder as well, Doctor, this concept of mixing and matching vaccines is something that we'd heard about as well. I know that's like 3 questions in one, but what are your thoughts on all of that?
Yeah, definitely. My phone blows up all day with these questions, so I'm happy to answer
I'm not
them
the only
here.
one. Good.
Yeah, exactly. So first of all, I think probably it's still best to go ahead and stick with the CDC recommendations. They will continue to change as things change and as we learn more about who benefits from a booster. So that's kind of the go-to, and that's what I would tell people. Now, mixing and matching, the reason that the mixing and matching has really come about is to make it easier for someone to get a booster when they do need that. And why did that recommendation come about? It looks like if you get Moderna or Pfizer, there isn't a big difference for the booster as to which one you should get. But if you did get the Johnson & Johnson as your first shot, it still makes sense to get a Moderna or Pfizer as your booster. Those do seem to be the best option for that third shot.
All right, Dr. Payal Patel, thank you for answering all of those questions. We really appreciate it.
Thank you.